work. So in this position, I'm able to assist these families with the entirety, all of the assistance, the resources, the additional care, the different therapies and treatments that they would need, that they can have a better quality of life outside of the hospital, right, or outside of long-term care, and help them feel, a bit more quote unquote normal, right? Live a better quality of life than just hospital and home.
That's amazing.
I'm excited. Mm-hmm. I'm excited. I know that it's going to stretch me, but God has given too many confirmations that this is where He needs me in this season. So I'm just moving in obedience.
If you didn't say it, I was going to finish the words for you, girl.
I am just moving in obedience. I'm moving in obedience.
That's great. Honestly, even just hearing your story, I feel like the role was created for you, So I look forward to hearing your journey and that. Don't be afraid to come back and tell us this is exactly this. Let me give you all the tea. This is exactly what it's like. But yeah, that's super amazing.
Yeah. And it's intimate, right? So I can be in the home, and God can have that freedom outside of the, the schedule.
I have another patient to go to. I can't stay. Like sometimes I will say sometimes that that does kind of get a little frustrating sometimes, like when you are kind of bonding with your patient and, or the family, and then, you have, your either your patient next door or someone else, or then now you have a cold or you so it kind of interrupts that moment. So that's actually really well. This is the nursing that's supposed to exist in the NCLEX hospital, so that's really great. That's pretty dope. It's pretty dope.
I'm excited.
Yeah.
I'm excited. But much is given, much is required.
Yes.
So.
Yes.
So
I'll send you out with some nurse aspect tissues.
Yes, please. But so that is where I am learning more and more that it is bigger than the license. Mm-hmm. It is bigger than the degree. It is a ministry.
Yeah.
For God to choose you to do this. Mm-hmm. It's a different individual. It's a special individual. It is not
a different anointing.
Yeah, it really is.
Different anointing. That's for sure.
It really
totally
is.
Agree. That's why sometimes they always say I remember when I was in school there was a girl that she cheated her way throughout the entirety of the program, the entirety of it. Mm-hmm. And people would get so upset because you're studying and I'm like, why are you guys paying attention to this one girl? She could cheat throughout this entire program, but can she cheat on the boards? No. Mm-mm. And let's say she makes it. Now, when you're actually working, if your heart's not in it, you're not going to make it. You're not going to make it. So it definitely takes a special person. Whatever your religious belief is, it really takes a special person to be a nurse in general.
Yeah.
But that's pretty dope. I'm not gonna lie, it's pretty dope.
Thanks.
Do you ever see yourself going anywhere else, or is there any inkling in you to do anything else in the future?
So I did a travel assignment, and for those that do travel assignments, that compared to the floor nurses, because they know that you're a traveler, they tend to give you, I don't want to say the short end of the stick, right?
But I do. You can say it.
Right?
The hardest assignment.
I'm telling you, but you either get the hardest assignment, or if they need someone to float, you are the one that's floating.
Yep.
And I know now what God was doing in that moment, but it wasn't actually the first half of the assignment. And in terms of peds or even the PICU, we know NICU, they have their staffing has to be, although all nursing floors should be great with staffing.
But the babies, they're not going to mess around with that.
They're not going to mess around with those.
You are adequately staffed on
adequately
NICU.
staffed.
That's not the place to, we don't have a nurse,
right?
Or
you
whatever.
You can't. So I would get floated to the NICU regularly, and my hesitation turned into such a love where I honestly preferred being on the NICU. When I was younger, though, I wanted to be an obstetrician.
Oh, really?
I did.
Oh.
I did. And then I realized how many years of school that was and how much
medicine will do that. Right on out this door.
how much it costs.
Yeah, no, yeah.
I was like, yeah, no. So honestly, at one point I was thinking of doing L&D. Like if I switched from the PICU, I was thinking of being an L&D nurse. Did get certified as a doula. So I sort of get that experience to assist with like the birthing. But I don't know. That would probably be, in terms of nursing, that would probably be the only other like specialty that I would want to go into. But I don't know, like outside of nursing, like what I would want to do.
Anything.
I think that, you know, God is nudging me into ministry, expanding the healing ministry outside of the medical field.
Okay.
I think all around spiritual healing, and not like spirituality, right? Like Jesus Christ is my Lord and Savior, you know? So I don't know, right? I don't know where he is desiring to take me, but I am sort of just in a fog. And if he tells me to move left, I'm moving left.
Just walking in obedience. So wherever the Lord leads you, you'll go. Yep.
Yeah.
Okay. I mean, you have a spirit of healing, you know, so I'm sure wherever you go, you're absolutely going to be flourished. It was funny when you were saying that, how that you know that you're going to be stretched. Yeah. Yep,
Yeah.
you are. But I also know that everything happens for a reason, and that the stretching, no matter with your nurse aspect tissues or not,
Right.
I feel like the stretching is going to lead you to wherever you're supposed to be. Wherever God is going to place you, that's where you'll be.
Thank you so much. I really received that. I really received that. It's needed. And even this space, right, this community for nurses is needed because we carry a lot mentally, we carry a lot emotionally, we carry a lot physically, and even spiritually. It's not a job that you can just clock out of.
Yeah.
Right? You leave your desk, you drive home, and that's it. There are some cases where you are either grieving or you are celebrating or you are invested in your patient and you're dreaming of the things that you need to do when you go back to that shift.
Right.
So
that's true. I was literally just saying that to my coworker the other day. I'm like, you know what? Nurses literally do everything. First of all, we're involved in every specialty. Doesn't even matter what specialty you're in, you're literally involved in every other specialty. If you work in neuro, you still have to do stuff for respiratory. You have to do stuff, maybe your patient isn't talking, maybe your patient's coming out of it. And so now we're talking mental.
Yeah.
You know, you still have to worry about GI. It doesn't matter what specialty you're in, you are involved in everything. And then on top of that, guess what? You're a therapist, because whether your patient can talk to you or not, the family's talking to you, or, you know, and then they're dealing with stuff like I can't tell you how many I've called codes for the family member because they're, you know, either going through something, or even just to have the moment to, like, you know, recommend something, pray with you, let me talk to you, whatever, encourage you for, you know, for something else. You're definitely a janitor. So guess what? Because, you know, you know, so we fulfill all roles actually. So, you know, sometimes, like, you know, you might even be a mini provider. Well, I mean, technically we are providers, but just in like, I'm calling you to, I need a bolus now. I'm not even waiting for you to suggest a bolus. We're not doing what I recommend. I need this now because you're not here and I'm here. So, you know, we literally take up all the spaces, you know,
and
so.
I think one of the things that drew me, and I was really blessed to have like great attendings in the PICU that I was at, because when they would do their rounds, there were a few of them, like seasoned attendings, that would, before they even start the round, they would say, rule number 1, if your nurse tells you something needs to get done, get it done.
That's a great
Get
attending.
it done.
Yeah.
If there's anyone that you listen to, you better listen to your nurse.
Mm-hmm.
And that posture is so needed throughout all of healthcare. But we really are the ones that are doing the minute by minute, second by second assessments. And you pop in, you pop out, you get messages, you get text messages, you get emails, but you don't know at the moment that there is a decline or there's a need for an advanced level of care. So I think that posture in having that sort of mutual respect between the different functions of the healthcare system was a great backing.
Yeah.
It was a great backing and a great confidence boost that you needed as a nurse, because we all need that.
Yeah.
We go through some things and we're like, I hope I did everything that I was supposed to do.
Yeah,
and I hope I did it all right.
Yeah.
And if I didn't, I pray that it did not, affect this life.
Yeah.
Like, it's lives that we're dealing with.
Of course, yeah.
So that was great.
Yeah.
I really hope that more units adjust to that mindset.
Yeah. No, that is definitely needed. Sometimes you can run into providers, and I've certainly run into providers that don't like take your opinion for anything.
Yeah.
And similarly, there are nurses that also do the same thing to PCAs. Like your PCAs, there's times when, like, depending on, for example, like in the med-surg role, we're stretched so thin, with the multiple patients because of staffing or whatever the case is and stuff like that. And so now your PCAs are there kind of more than you are. Yep. And there's times when, like, people don't take their PCAs for granted, and you can't do that. To me, it doesn't matter which direction it's coming from.
Right.
The person that's really there with the patient more is the person that you really should be taking, to collaborate more, and not like, you're just this, you're just the RN.
Right.
No. At the end of the day, it doesn't matter. We're here for the patient. And
I was a PCA for years going through nursing school. Yeah. On a tele floor, which is why I didn't want to do tele.
Okay, I still have my cardiac days now. Okay, even though I'm like, ooh, child, I still miss cardiac. But go ahead. But I understand why.
Right?
I'm not gonna pretend like I don't get it.
The thing, and that's the other thing, especially everything leads to the heart.
Everything.
Everything.
You could literally be on tele. You could come to the tele floor because you are in a rapid AFib. Really, it could just be a sinus tag.
Right.
But guess what? You're really admitted to the hospital because you had like a bipolar exacerbation. They have nowhere else to place you. This is
renal, diabetic,
everything.
Like everything.
Literally
cellulitis. Everything. It doesn't matter. Like it literally didn't matter.
Yeah.
Everything somehow
let your potassium be a little off. We're on tele. Yep. So okay. Fine.
I'm telling you,
med-surg it's a specialty in itself, but everybody gives it like, nobody really looks at it as like a specialty. It always looks at that like it's looked as the bottom of the barrel, but it really isn't. It really isn't.
It really is training ground for
it is.
Everything.
It's the foundation. Yeah.
Everything. So even so having that understanding, a lot of nursing I learned as a PCA.
Yeah.
And I had great nurses that, encouraged you and knew you were in nursing school. So they would show you some things and have you do some things. But with that understanding, I had no issues with my PCAs because they knew that I know. And if you tell me this is what's going on, I'm going in the room.
Yeah.
I'm going in the room.
Yeah.
So yeah, if we all had that like collaborative care and just respecting everybody's role and understanding that we are not going to be successful without the other, it would be a whole different dynamic.
Yeah, it definitely would.
For everybody.
It would be the NCLEX hospital for real.
For real.
The perfection of nursing.
Yeah. Mm-hmm.
Do you have like a tip that you would want to share to either like your former self or something that you wish that maybe somebody told you? Something that you feel like, maybe people should know?
I would say, especially new nurse, starting off, when you find a report sheet that you can flow with, that You can get, you're not, it has everything listed, so you're not missing any systems, you're not missing anything. Keep that report sheet and take it with you wherever you go, because every system, every unit has a different flow of things. And if your report isn't great, it can throw off your whole shift. If your report isn't good, it can throw up. So once I took my ICU report sheet with me everywhere. If I traveled, if I floated, if I went to another healthcare system, I took it everywhere. So I knew I wasn't missing anything. I knew exactly what I needed to ask, when I needed to ask it, and it just sets you off with a better foundation. I'm thinking.
That's actually a really great tip. I'm not gonna lie, because it brought me back to when I first started in the hospital. I did not know how to take report, and I didn't have.
It could get intimidating.
So I never really learned it. And I remember this one nurse pulled me to the side. He was like, "No, baby, I'm gonna show you." He was looking at me give report, and I was just all over the place. He stopped me. He was like, "Shh." He's like, "I'm gonna write this down for you, and this is how you're gonna take report. This is how you're gonna give report." And I remembered that for a long time. I mean, I still remember it now, even though I don't use it now in the field that I'm in, but I still remember it now, and it made such a difference, because guess what? Once your nurse leaves at 7:00 whatever or 7 blah blah blah, you could have a rapid response in the second they walk out. And what are you going to say?
It's like whatever that witching changes shift is,
and don't let it be a full moon outside, because I'm telling you, I remember my first rapid, I got report, and I had I just remember the nurse left, and he was trying to leave. He was trying to be out, and me and him crack about this before, so he knows who he is. But I remember he left. He went to dinner or whatever he was doing. And I walked into the patient. We didn't do bedside report, which also
definitely the bedside.
I walked in, and this lady's dentures was half hanging out her mouth. She's on a cardizem drip. I can't find a PCA because I'm freaking out, because I'm I don't know. I don't even know what to do. Now I'm the nurse. I can't even be let me call somebody. And I remember okay, let me go and take a blood pressure, because at least let me do that. Right. Forget about the cardizem drip. I forgot about that. I'm she's on something. I just know that she's on something. Right. I take her blood pressure. It's soft 90s. She's not really that coherent. She has a history of dementia. So I can't even ask her questions. There's no family. It's COVID, And I'm she just doesn't look good. I'm almost afraid to leave to go and check my other patients. So I'm let me just take another blood pressure again while I'm thinking. I take it again. Now we're in the 80s. I'm okay. She's still the same though, looks the same. And I remember I asked another colleague to come and just take a look. Do I call a rapid or not? And so she comes in, she looks at the patient, and she was like, "Yeah, we're calling a rapid." So I'm okay. Get yourself together, Rebecca. You're get your papers together and stuff like that. So now I'm looking at my papers. The doctors come in and who's the nurse? And I'm me. And they're okay, why is this patient here? And I'm 73-year-old patient. Well, she was 90 something. She was here from the ED and they're looking at me girl, what? Why is she here right now in this bed? And I'm oh, okay. And they're looking at me anyways. So then they take over, because they had a history. And so they're doing this stuff. And I'm I remember feeling so embarrassed and just being I didn't know how to take a report, and literally he left and I had a rapid, and I did not know my patient. So I always felt you had to know your patient, know your patient, what's your patient name, and have some sort of rapport with them. And that's not what it means. Having a good report and knowing how to take report makes a difference, because you are responsible for this patient, and if something happens, you need to be able to respond, and you don't want to sound stupid.
You don't.
And honestly, those seconds matter too. Those, every little second matters. So yeah, I think that's a great tip.
I listen. I would, as you were talking, there was another thing that came. Don't be afraid to wake that attendant up. Don't be afraid. I remember we had this, I feel maybe 2 months old. I'm going to say maybe 2 or 3 months old. And cold and flu season. sibling at home, and now we're here with RSV. And RSV in a 5-year-old is a completely different thing than RSV in a 2-month-old or a 1-year-old. And we had the child on like, I think it was like a CPAP or something, but it just wasn't cutting it. The settings weren't cutting it. The respiratory therapist was in there, and I'm looking at this baby pulling in every direction, like counting every rib on the body. And the resident, you know, I kept telling him, things need to adjust or else we're going to have to intubate this baby. And it shouldn't have to get to that. We just need to change the settings. And of course you did all your chest PT, all the things, nothing's working. And the resident is just sitting there like in a whole nother world. And I'm looking at the respiratory therapist, and the respiratory therapist looking at me. And I'm like, no, you're not about to have me code this baby, because they weren't confident in what they wanted to do, but they did not want to wake up the attending. It's 2:00 in the morning. And I came out and I was just like, I'll take whatever blow I'll take it, but I'm not going to get the backlash from the family or have this patient literally like decline because you want to stand there like I have 5 heads.
Yeah.
So I ended up paging the attending. And of course, like I'm seeing him come on the floor and I'm like, my knees are like trembling. Because it rectifies everything. And I remember it like it was yesterday. After everything, he came to me and he said, thank you so much for paging me. You did an incredible job.
That's dope. Honestly, as you're talking, it just makes me also like remember, yes, we are also advocates for our patients. And and I know it definitely takes time for the confidence to build up to get to that point. But yes, don't be afraid to wake up your providers. You chose this life. You're on the clock. Right. Guess what? Next to my badge, it says RN next to it, and it doesn't say MD. Okay.
And I was a new nurse. I just got off of orientation.
That's even better.
Yeah.
Wow.
So that was another reason why I was trembling. Like my nurse never woke up an attending out of their bed. They were able to figure it out with the resident that was there. But so here I am, the new nurse, and I'm going to get like a heavy hitter attending, like not a new one, like a seasoned and waking tall
towering
over you. And he came, I thought I was going to get like scolded about something. And he like literally tapped my back and was like, you did an incredible job. Thank you for waking me up. So do not be afraid. If you need to elevate and you need to rank up, then just do it. Just do it.
That's amazing. I love the tips 2 for 1, and both great tips that will never go out in style. They could always use those kinds of tips.
It better safe than sorry.
Yes, for sure.
Yeah.
Thank you so much for stopping by. This is so dope. You got to let us know how it is being a nurse coordinator. I would love to have you back for you to share. Like,
I think I would love to do this again.
Yes,
this was great. This was so great.
Thank you.
And your presence, like, just by the way, like you're really, this is a part of what you are supposed to be doing, because you really do embody the safe space. It's not just like, oh, we can sit and talk. Like, you make it safe.
Oh, thank you.
You're welcome.
I think I received that. I feel all the tingles. I'm about to take talk offline. Like, have you pray over me. Thank you. Thank you so much. Thank you so much. I really appreciate the time for you coming out. And again, you're more than welcome to come back. To everybody else out there, besties, like, subscribe. We are available on all platforms: Spotify, Apple, iHeartRadio. Run them down. Okay. Yes. YouTube, check it out. If you ever want to be part of the show, hit me up at thenurseaspect@gmail.com, and we'll catch you on the next episode.